name's Laura and I've been with the Trust for 6 months and I work for Acute.
Hi, my name is Carol and I have worked with the Trust since I qualified in 1979. So I have worked with the Trust in total for 47 years. I worked for Craigavon Hospital when it was Craigavon Hospital. It became a Trust, so I just stayed with them. And it was handy, close to home. I live in Lurgan and it's close to home.
I chose the Southern Trust because I live close to here, but also Daisy Hill feels like home to me, so it was always going to be here.
All the uniforms had changed big time whenever I qualified. Whenever I was a student nurse, we wore dresses. We wore starched fall hats. We had to wear tights. Had to be a certain denier tights and white shoes. You had to wear white shoes. Far better now. Uniforms are far better. Trousers are a lot easier to work on with on the wards. Definitely, you never wore the dresses, but the skirts,
No.
you're trying to hoist your dress
It's just
up
not convenient.
and working with the patients, we didn't have the hoists, we didn't have slide sheets, we didn't do moving and handling, we did lifting and handling. We lifted the patients, so you were hoisting your dress up when you were getting up onto the bed and you were hoisting patients.
Yeah, that's not practical.
No, it's not, but that's the way it was.
It was.
Now we have the hoists now, we have slide sheets, we have all the other equipment, you know, the steadies, everything now that we didn't have back in the day. Something. See, even gloves. We didn't even have gloves.
That's mad.
So we didn't have gloves. Well, what do you enjoy most about it?
I enjoy most the patients that we go out to see because they're so grateful to see us when we come out, and it's just a completely different experience than them coming into the hospital, and they're so grateful for it.
You have more time in the community with them. Definitely a lot more time to keep you at home. You have more time, you can go in, you talk to them, you see their families, you see them in their home.
You get an idea of like their home setup.
When you're in hospital, it's different. Especially at the minute when there's no visitors or very few visitors or whatever.
You get to see the person for who they are outside of the hospital in their own surroundings, which is really, really nice.
Yeah. I have made some really good friends. I have a couple of friends in particular that I am still very friendly with. They're both retired. I'm still very friendly with them. We still meet up.
Need good friends in work, I think.
You definitely
especially in situations that you might be in.
Yeah.
Or like just someone to like, you know.
You do. No, you do. There's someone that you can sort of bounce off.
Yeah, definitely.
It's there for everybody. I think that's the thing about it. It's there for everybody. No matter who you are, what you are, you'll get treated.
I think that it's hard work, but it's really rewarding.
This is just a few wee bits and pieces I have from my graduation. This was my certificate of registration. This is what we got whenever we registered as a registered nurse, with our PIN number on it and the date of registration. This one here, this is just to say that we have pleasure in informing you that your name has been entered onto the general part of the register for nurses. And it was the Nursing and Midwifery Council, the Northern Ireland Council for Nurses and Midwives at that time, which has now become the NMC. This was my receipt, as I say, for my registration, £17, I think. Might have been a bit more, might have been 18. And this is the permit for my uniform. We couldn't get our uniforms until we got this permit, and we got this with our registration. And once we got those, we could get our uniforms, we could get our falls, and we could practice.